think this is going to be quite an interesting one today, as there's some rather contentious information out there when it comes to LED and LED face masks in particular. Today, we're going to be talking with Lotti from Déesse Pro to hopefully clear things up for us, including your fine lines and acne. So, thank you for joining us, Lotti. Welcome.
Thank you so much for having me, Erin.
Right, well, we know this is our 10 minutes and 10 questions, so let's get straight to it. So, could you help us out with what type of light is being used in your face masks?
Absolutely. So we use LED light therapy. So we actually use a process that's called photobiomodulation. And what that actually translates to in basic terms is using photon energy, which is light energy, and actually evoking cellular processes within the skin by different wavelengths of light. So it's perfectly safe. It's, natural cellular processes, but we are just turbocharging them and stimulating them.
Fantastic. So now I've seen that there are a number of different colors in the face mask. Could you help us understand what they're beneficial for?
Absolutely. So our devices have between 4 and 5 wavelengths of light, and each of those wavelengths correspond to different cellular processes within the skin. So I'll start with blue, which is our shortest wavelength. So we actually use blue at the specific wavelength of 415 nanometers, and that actually travels just to the epidermis layer of the skin, and it interacts with P. acne bacteria, which obviously is the bacteria that's responsible for acne vulgaris. And what that does, when the bacteria actually absorbs the blue light at 415 nanometers, it actually causes the cell to die. So it's a really interesting chemical reaction, perfectly natural. It doesn't cause any, causes of sensitivity to any of the surrounding cells, but you do get this destruction of the bacteria and obviously the destruction and the stopping of the acne bacteria within its tracks. So it's a brilliant non-invasive way to treat acne, and certainly can be used, in conjunction with any other skincare treatments or alternative therapies that you're also using. We also then are the pioneers of green light therapy. So at this wavelength, we are looking at 520 nanometers. So it's slightly longer in its form, and it's actually traveling to the basal layer of the epidermis, so slightly lower down. And what this does is it's a really brilliant treatment for hyperpigmentation. So it actually interacts with the melanocytes, which, as we know, are the cells that are responsible for forming the pigment and that melanin synthesis. But it interacts with those melanocytes to stop and halt that formation. So if if you do have a skin type that is particularly prone to melanin formation, sun damage, sun aging, this is brilliant because it can help to slow that process down. It also has been shown to break up melanin clusters within the skin. So any areas will see improvement over time. And again, it's one of those wavelengths that, as I say, we pioneered. We do see it now more frequently in other devices, and that is because the clinical data has finally caught up with what we were seeing. And then we go more into our red and near infrared. So these wavelengths are at 630 and 830 retrospectively, and they travel within the dermis layer. So these actually target fibroblast cells, which are the cells that are responsible for the formation of collagen, elastin, and hyaluronic acid. So these are really the building blocks of our skin. They are the things that keep our skin looking healthy, or keeping it healthy, but also looking and feeling supple, preventing obviously those signs of aging. So as we know, as you age, your skin obviously depletes in all of these great, proteins and molecules. And with red light and near infrared, turbocharging obviously these results gives that instant boost of collagen, elastin, and hyaluronic acid. It's actually been shown to be up to 16 times more effective than doing nothing. So it's a really incredible, anti-aging sort of support mechanism to your other products that you are using. And then also we have 1070, which is in our newest device, the EOS X by Déesse Pro. And this is a professional only device, but obviously you can use it in salon spas and clinics. We use them in a lot of medical esthetician clinics. And this wavelength actually penetrates deep into the muscle layer, and it causes the pro-inflammatory response. So we use it in synergy with 630 and 830. It actually has the, as I explained, the pro-inflammatory response in conjunction with the anti-inflammatory from 630 and 830. And these two work synergistically to give you this ultimate wound healing response, which, as we know, is kind of turbocharging, obviously, the collagen, elastin, and hyaluronic acid. And historically, or, at the moment, the only way to actually evoke a pro-inflammatory response is by mechanical injury. So it's actually like processes like obviously natural, wounds, but also microneedling, chemical peels, those more invasive procedures that actually cause damage to the skin to evoke this pro-inflammatory response. And it's really nice that we are able to offer this, obviously, in the device without causing any of that downtime, the sensitivity, obviously the irritation, and yet you still have this amazing turbocharged result.
Wow. And can these colors be combined at the same time?
Absolutely, yes. So in the EOS X device, we actually combine more of our wavelengths than you will see in our previous model, the Pro.
Fantastic. So how is this different to full body red light, for example?
Well, I mean, it would be specific on obviously the device that we're looking at, because there are lots of things to consider when you are comparing LED devices. And I'm sure we'll talk about that in a moment. But certainly, like looking at the wavelength is the most specific thing. There is lots of clinical data to support the wavelengths of 630 and 830 nanometers of red and near infrared light. And those are the wavelengths that are most commonly found in obviously the red light therapy treatment beds, because they are not only for revitalization, but they are brilliant for pain management and have a whole host of other benefits, bringing energy obviously to the body and really helping with inflammation and pain. So it's not that the technology is really any different, it's just the format that it's being delivered. Our devices currently are predominantly for the face and for beauty benefits. We do have some wellness benefits obviously associated with red light as well, inducing serotonin production, so your happy hormones, and also improving your circadian rhythm and melatonin synthesis, so all about your sleep cycle. And those results you will see from both our mask and also the body, but it's just obviously the treatment area that you are treating.
Excellent. So what makes commercial masks different to, say, the home masks that you can find or buy off the internet?
Yeah, so there are a few differences to consider when you're looking at obviously purchasing a mask. Number one, I would say the quality of the bulbs. So the quality of the actual LEDs. In our devices, they are in a hard shell format. Now, there are two reasons for that. Number one is we have to have that hard shell format and able to house the actual medical grade LED bulb that we use. And obviously, these bulbs allow for much more power to actually be, presented to the skin. The bulbs that we also use can have actually up to 3 wavelengths of light within one bulb. So some of them, have 630, 830, and the 1070 all coming out of one bulb. So you get much more efficacious dosage. The other thing to consider, as I said, is with the proximity of the device to the skin. So our hard shell format actually fits the contours of the face perfectly. And this, we use a method called the contact method of light therapy delivery, which literally means that, obviously the device is touching the skin. But what that allows for is obviously minimal light loss during the distance between the source of the LED and obviously the skin. And the easiest way for me to explain this is if you think of a torch, and the energy, this is the torch, so we're shining the light energy onto a surface. If it's shining from a distance, you get this large dispersal of low level light. If it's shining directly or touching the skin, ideally, like our devices do, then you've got a much more focused concentration of the light energy, and it's much more coherent in its form, and therefore obviously eradicating a better result in a much less smaller time frame. So it's important to look for those two things. And certainly I think just really looking at the clinical studies, like how people are using these devices and the clinical data that they are supporting with. Our EOS X device, for example, the red light and near infrared mode of anti-aging mode 1, it actually has been clinically proven to reduce fine lines and wrinkles by 37.6% within just 4 weeks. Now, that's pretty remarkable from a device that doesn't give you any, downtime, any sensitivity can be used in conjunction with anything else that you're using or any other treatments you love. So those are the main things that I would consider.
Excellent. So how often should people have a session, and how long is each of those sessions?
Yeah, ideally we say between 2 to 3 times per week if you're looking for a more intensive treatment. Dependent on obviously the wavelength that you were using. Blue light, for example, you can see an immediate result. So it does take obviously the inflammation down. It will kill the P. acne bacteria almost, well, it kills it instantly, but you will see obviously within a few hours that the spots and blemishes will reduce in size and obviously the irritation. Whereas if you're looking for more red light therapy and collagen elastin synthesis, it is a little bit more of a cumulative result. So we would say 2 to 3 times per week. It's only a 10-minute treatment, so it's super quick. And really with light therapy, it's not that you will do any damage if you use the device more than that, but you won't necessarily get more of a result because obviously the skin can only absorb and respond to a certain amount of light energy at any one time.
Fabulous. I think that answered my next question as
I
well.
know,
So
I'm
that feels
sorry.
so what kind of businesses are you seeing adding LED masks to their offerings?
Yeah, we've got a really diverse, type of businesses that integrate LED. Obviously, initially, LED did start within the sort of medical space. It was more about wound healing, and I don't know if you're aware, but NASA actually identified LED for its wound healing benefits because they were cultivating crops in space and actually saw just by chance that it actually healed wounds on the hands of the astronauts that were using it. So it's really interesting because obviously dependent on the business type that we are working with, whether it be a spa salon or whether it be a medical esthetician, they're integrating it for different reasons. So in a clinic, they're using it post-procedure, post-inflammatory procedures such as microdermabrasion, chemical peels, microneedling to take down inflammation, obviously stimulate that wound healing response and improve that patient outcome much quicker than they would normally see. Whereas in spa and salon, it's much more about obviously, yes, the amazing skincare benefits of, anti-aging acne, but also about relaxation and just again, improving the patient's experience whilst they're in having that treatment. So it can be really easily integrated or added on to existing treatments.
Fantastic. And because this is another one of those wonderful touchless wellness pieces of equipment,
Yeah.
they can also be used at the same time as some other technologies. What are
Yeah.
you seeing them being combined with, maybe like with the therapy layering side of things?
Absolutely. I mean, I think honestly, the possibilities are endless. We see a lot of people using it with IV drips, for example. There's also the opportunity to apply this whilst you're giving a hand and arm massage, or maybe, focusing on a chest and neck massage. Because the device is so lightweight and quite portable, it really doesn't interfere, with any of the treatment that you're also doing. I think, you could even integrate it with pedicures, manicures. It's really interesting and certainly something that I think as we explore this space more and people wanting to achieve more within the 10 minutes or 20 minutes of me time that they do have, it's certainly a really nice complementary therapy.
And so now for the money question.
Yeah.
How much can businesses typically charge per session?
Yeah, we would recommend between about 25 to 40 pounds, dependent obviously on the competition in your area, location, and how you're integrating it into your treatment menu. So if you were offering it as an add-on to a treatment, then that's where we would normally say around the 25 pound mark. If you're offering it as a subscription package, then it might be slightly more than that, or obviously you can offer it as a 12-week course or something. But it's really easy to integrate. It's really easy to monetize. And because of the versatility of the device to treat really all skin tones, types, ages, stages, that you can offer this to pretty much every customer that walks into your space, into your business. And that makes it, a really solid device to generate that return on investment really quickly.
Amazing. Well, thank you so much for joining us today and enlightening us with
Ah,
some information on
I
on
love
LED masks.
it.
So yeah, thank you very much, and we hope to hear more from you soon.